At this point, kind of test fitting on the patient. I like to just put it on and do a dry test fit because there's a little bit of manipulation with the applicator on getting it where we want. So coming across the top of the head.
Kind of sense. So no one wants to be all jowly and dowdy. And so we want to undowdy the face. We want to tighten the jowl and the jawline. And she doesn't want perhaps AccuTite. She doesn't want necessarily face tight or suture suspension. So we're going to the only non-invasive lifting technology out there.
Placing the gel just on the applicator,
cool.
Just like that. Company recommends anywhere from 15 to 45 minutes. I find a lot of offices usually treat around 30 to 45.
Okay, and in my office, typically if it's a heavier, more jowly face, I want to perhaps contour more of this. I'm going to be extending that time. So Natalie, how long we've been cooking along here?
35.
So 35 minutes, and we're in the submenum. We've been in the, let's come back to the machine there. Art, that's awesome. We've been in the yellow zone, 43 degrees Celsius for a good 30 minutes, and we've been 44 to 45 in the fat. Has this been reasonably comfortable, Natalie?
Yeah, it's definitely warmer.
Warmer than?
The jaw was.
Okay, and would you say tolerably warmer?
Yep.
But you wouldn't want to go much longer than this.
No.
So most patients, 40 minutes is about it. That means we're cooking her fat. I can smell. The smell of frying adipocytes. Okay, we don't want to pull her extensions out. So chin back just a bit. I'm kidding. Wow, that looks, wow, you took away my thunder from, there is a little bit of tightening even on the table. I can see a better cervical mental angle. I'll show her pictures after. But typically I'd tell her she needs a treatment once a week for 6 weeks. You can buy a 3-pack up front, 3-pack at the next paycheck. Or buy all 6 up front, save 20%. Some retail model like that. But that's the kind of endpoint you want to see. Very erythematous, a good right at the hyoid cervical mental angle, but no blister, no epidermolysis. That's a nice endpoint. But of course,
from software to books to webinars and tips of the week, find out more at boomerangfx.com.